Welcome to Medicare 101, an overview of the A, B, C, and Ds of Medicare. Please remember the information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sarah Rothschild, the VP of Program Services, and I am your moderator for today. I would like to introduce you to our presenter today, Kathy Sarmiento. Kathy has been working for the Alliance for Aging for 15 years. The Alliance for Aging is the nonprofit area agency on aging for Miami-Dade and Monroe counties in Florida. In her role as the SHINE liaison, Kathy manages all aspects of the free SHINE Medicare counseling program. Kathy also manages the Benefits Enrollment Center at the Alliance for Aging. The Benefits Enrollment Center is a grant from the National Council on Aging to provide 5 core benefits to financially needy Medicare beneficiaries. These 5 core benefits are Medicaid, food assistance, assistance paying for Medicare, prescription drug assistance, and assistance paying the light bill. At this moment in time, I'd like to transfer the presentation over to Kathy. You may begin.
Hi, Sarah, and hi, everybody. It's so great to be here. Today we're going to talk a little bit about Medicare, and I look forward to answering any questions that we have at the end of the presentation. So we're going to jump right into it. One second, please. Thank you. Now that we're here, there we go. Many of you you'll see during this presentation that I am in Florida, and our vision is that all Floridians age with dignity, purpose, and independence. But I do understand that there are people listening who are from other states. The mission of the program that I manage is to provide free and unbiased health insurance counseling through a dedicated network of volunteers. And in some states, these are not volunteers, they're employees of the state. But here in Florida, they are volunteers, and our mission is to empower people to make informed healthcare choices. This is a disclaimer because all of the information that our program provides is free and unbiased and confidential. So here in Florida, we have 11 SHINE programs, and to reach the SHINE program in your part of the woods in Florida, you would dial 1-800-96-ELDER, which is 1-800-963-5337. If you are in a different state, you can go to medicare.gov and click on the tab on the right-hand side that says Form, Help, and Resources, and then look for helpful phone numbers and look for SHIP, S-H-I-P. That stands for State Health Insurance Program, and you'll reach the people that do the same thing that I do. Okay, there's our logo. Woohoo! So our mission at this program is to explain original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, which is also known as Medigap insurance. We help people with low income apply for low income subsidy extra help for prescription drugs, and we also help people with a Medicare savings program that pays for your Medicare. We also provide counseling for long-term care planning, and we assist clients with Medicare complaints and appeals. We have a grant through the Senior Medicare Patrol to educate people about Medicare fraud and abuse and how to prevent yourself from fraud, how to detect fraud, and how to report fraud. So we're going to go into Medicare. Medicare is a federal hospitalization, medical, and prescription drug insurance program. Unlike many other types of health insurance programs, Medicare benefits cannot extend to a spouse or another dependent. So all eligible people must be enrolled individually if they want Medicare coverage. And Medicare was created in 1965 as Title 18 of the Social Security Act under President Lyndon Johnson, and Medicare actually became effective July 1st, 1966. So it's the nation's largest health insurance program, and it's covering nearly 50 million Americans. And here in Florida, we have 4 million Medicare beneficiaries. So while Medicare is administered by the Center for Medicare and Medicaid Services, which is known as CMS, the Social Security Administration is responsible for enrolling most people in Medicare. And if you've worked for the railroad, then the Railroad Retirement Board is responsible for enrolling railroad retirees in Medicare. But in 15 years, I've only met 2 people who worked for the railroad, so most everybody else has to go to Social Security to enroll in Medicare. And there are different parts of Medicare. Part A helps to pay for inpatient hospital stays, and it helps cover eligible skilled nursing care, home health care on a short-term basis, and hospice care. Part B covers medically necessary services like doctor's visits and outpatient care. And Part B also covers preventative services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. And when somebody has Parts A and B, that's called Original Medicare. Part C is another way to get your Medicare benefits, so it provides Part A and B coverage and often Part D prescription drug coverage. Medicare Advantage plans are managed by private insurance companies approved by Medicare. So when somebody has Part C, they're talking about another name for that is Medicare Advantage plan. And these plans must cover medically necessary services, but the plans can charge different co-payments, co-insurances, or deductibles for the services. And the last part of Medicare is Medicare drug coverage that help pays for outpatient prescription drugs. So there's another type of insurance that people purchase when they have Original Medicare. Instead of joining a Medicare Advantage plan, some people like to purchase Medicare Supplement Insurance, which is Medigap. And we'll go into why one would choose one versus the other in a little bit. But those are the letters of Medicare. So now, who's eligible? You have to be a United States citizen, and there's an age requirement. So you have to be age 65 and have worked for 40 quarters. We do have a lot of people in the country who have Medicare because they're age 65 and they've been here for at least 5 continuous years prior to enrollment. And the other, there are people who are given Medicare who are younger than 65 because they've been receiving Social Security disability income for 24 months, or they have end-stage renal disease, or they have ALS. So other factors can impact a person's costs under Medicare, but they don't have any impact on your eligibility. So even if you're disabled, once you've been disabled for 24 months, you can have Medicare. And you go to Social Security to apply for that. So now, people who are already receiving their Social Security pension are going to automatically be enrolled in Medicare when they turn age 65. But most of us are still working, or if we're not working, perhaps we turn 65 and we have to enroll in Medicare. And Medicare enrollment is done at Social Security, or you can do it online at ssa.gov, which is the Social Security website. And so most people, they enroll in Part A and B when they turn 65, 3 months before up to your 65th birthday. And you can actually enroll up to 3 months later, but generally people want their Medicare to start as soon as they turn 65. Or if you've been disabled for 2 years, then you're going to be given Parts A and B. But since Part B has a monthly premium, some people choose to opt out if they don't need the coverage. And those would be people who are working and who have insurance that's from their employer that is creditable, which means it's as good as or better than Medicare. And your employer will know if your insurance is creditable. If it is, you can delay receiving Part B with no penalty. But generally, people voluntarily enroll, and they do it when they're going to turn 65 or after they've been disabled for 24 months. So let's talk about the different enrollment periods. There's the initial enrollment period, which is the first time that you get Medicare. There's a general enrollment period for people that missed that, and that's from January to March. And there are special enrollment periods. And the special enrollment periods would be like if you're working and you didn't sign up for Part B, and then later on you decided you wanted Part B. That's a special enrollment period you have, and there's no penalty. Another special enrollment period is if you move from one county to another, because the insurance is different in every county, meaning the Part D drug prescription insurance is different. Your Medicare Advantage plans are different, and the Medigap is different. Another special enrollment period is if you enter or leave a skilled nursing facility. We have a lot of people here who perhaps they're in a Medicare Advantage plan, they go into a skilled nursing facility, and the nursing facility wants them to get out of their Medicare Advantage plan so that the nursing facility doctors can see the individual. And that is a special enrollment period, and we can do that. So your initial enrollment period is the 7 months surrounding your 65th birthday, normally. So let's say your birthday is in April. If you enroll within the 3 months before your April birthday, then your Medicare Parts A and B are going to start on the first day of your birthday month. So they would start on April 1st. If you enroll in your birthday month, then your Medicare starts the first day of the following month. Let's say you wait because you didn't know and you enroll 1 month after your birthday, then your Medicare starts 2 months later. If you enroll 2 months after your 65th birthday month, your Medicare starts 3 months later. And if you enroll 3 months after your 65th birthday month, then your Medicare begins 3 months later. So the best time to enroll is during the 3 months before turning age 65. And the initial enrollment period, if the initial enrollment period is due to the fact that you've been disabled for 24 continuous months, your enrollment in Medicare is usually automatic. So we're going to talk about original Medicare. Remember, that's Parts A and B. So Medicare Part A is your inpatient coverage, and not all charges are incurred during your hospital stay will be covered by Part A. Only those that are billed as a part of the hospital's standard inpatient care. Your other charges might be covered under Part B. So Medicare Part A only covers patients that have been formally admitted into a hospital and are receiving inpatient services from a hospital that accepts Medicare. It covers your inpatient hospital care, blood after the first 3 pints, skilled nursing facility, which means after you've been in the hospital when they send you to the rehab. It'll pay for home health services to avoid hospital readmittance. But once you've been out of the hospital, Medicare does not pay for long-term care. And Medicare pays for hospice care if you're going to pass away in the next 90 days, and the physician has written that prescription for hospice. Medicare Part B covers most outpatient services as well as hospital charges that are not billed as inpatient, for example, outpatient surgery. And there's usually a 20% coinsurance that you as the Medicare beneficiary are responsible for paying. Part B also covers emergency room treatment. And with the exception of emergency rooms, Medicare will only cover services rendered by a provider who chooses to accept Medicare. So when you go to the doctor, you want to make sure that that's a doctor who accepts Medicare. let's talk about how much it costs. So when people have original Medicare, Parts A and B, they can go to any provider who accepts Medicare. And by provider, I mean hospital or lab or doctor. Your Part B, your Medicare Part A, which is a hospitalization, in 2019 is what I would say free. There's no monthly premium because you've been paying taxes for 40 quarters, and therefore your Part A is premium free. Part A has a deductible when you go in the hospital of $1,364, and Part A covers days 1 through 60 in the hospital. But on days 61 through 90, there is a copayment, and then on days 91 through 150, there's a higher copayment. Part B, it will cost everybody a monthly premium, and for most people who, if you're single and your annual income is less than $80,000, your Part B premium costs $135.50 this year. And there are many people who earn more than $80,000, and their Part B premium is higher, and I can send the list of what those premiums would be if your income is higher. There are many people whose income is very low, and so about 28% of Medicare beneficiaries pay either nothing or $109 because they've applied for the Medicare Savings Program to help pay for the premium. Part B also has a deductible. So in January, it's an annual deductible, and in January when you go to the doctor, they're going to ask you to pay $185, which is the Part B deductible. And of course, as I mentioned before, Part B only pays for 80% of medically necessary costs. So if somebody has just Parts A and B, they're going to pay 20% out of pocket. So those are the charges, and they change every year generally. If there's a cost of living increase by Social Security, then they up the premiums a little bit. So that explains the premium. A lot of people say, well, I don't want to pay that deductible in the hospital. I don't want to pay for the Part B deductible, and maybe I don't want to pay the 20% out of pocket. So they decide they're going to buy a Medicare supplement insurance called Medigap. And the way these work is Medicare Part A and B pay their part, and they send the rest of the bill to the supplement insurance company to pay the rest. And the purpose of this insurance is to fill the out-of-pocket gaps in coverage under original Medicare. So insurance companies that sell these policies must follow federal and state laws to protect people with Medicare, and the Medigap policy must clearly be identified as a Medicare supplement insurance. So this Medigap policies only work if you have original Medicare Parts A and B. If you join a Medicare Advantage plan, then your Medigap wouldn't work. So it's an either-or scenario. You either have A and B and you buy a Medigap supplement, or you join the Medicare Advantage plan. And in the world of Medigap supplement, there are different policy letters. They're standardized plans. And so when we're looking at supplements, we want to look at these letters and say, which policy letter do I want to have? And I want to make a point that the policy letters are not the same thing as Medicare Part A and Part B and Part C. No, this chart is just talking about Medigap supplement policies. So it's important to compare the Medigap policies because the costs can vary. And for example, this year in 2019, the letter F, like Frank policy, covers everything a Medigap supplement can cover. It pays for days 61 through 365 in the hospital, which is your Medicare Part A coinsurance. It pays your Medicare Part B coinsurance, which is at 20%. And I know that because the box is checked on the chart. It pays the first 3 pints of blood. It pays your hospice coinsurance. It pays skilled nursing facility coinsurance, which is really days 21 through 100 when you're in rehab. It pays your Part A deductible of the $1,300. It pays the Part B deductible of the $185. It pays for Part B excess charges because the doctor and providers are allowed to charge you 15% more than they get paid by Medicare. Some of those doctors pass those charges along to their patients, and if they did, then this F supplement would cover that. And this supplement also covers foreign travel emergencies up to 80%. And that can vary depending on the country. So I always say ask the insurance company that's providing the Medigap supplement, what do they mean by foreign travel emergencies? Do they mean they're going to medevac you back to the U.S. or are they going to pay for a hospital? It can vary depending on the company. So now, in the year 2020, Medicare has stated that they're no longer going to sell the F like Frank policy because the insurance industry has said that they want people to have more skin in the game. So the next best coverage is the G policy, and it pays for everything except it doesn't pay for the Medicare Part B deductible. It doesn't pay for the $185 a year. So if you want to join an F policy, you have to sign up before the open enrollment period, which starts on October 15th. And if you already have an F policy, you'll be grandfathered in and you'll just keep it. But starting at this open enrollment period, the G policy is the one that's going to be for sale. Some people say, listen, I don't need that much coverage and I want to pay less. So then we would look at a different policy letter for their supplement insurance. And of course, the monthly premium is going to be less. The reason why people buy these supplements, these Medigap supplements, is because they are good anywhere in the United States as long as the provider accepts Medicare. They have to accept the supplements. So for someone who has a lot of different doctors and specialists, a supplement's a great idea. Also, because you don't need a referral or to see a specialist when you have a Medigap supplement. You can go wherever you want, whenever you want. And it's also great for people that live half the year in one place and half the year in another place because the supplement will work anywhere in the U.S. So if you're a snowbird, then a supplement's a great idea. So once we figure out which supplement a person would like, then we say, well, which insurance companies are selling it? And on Medicare.gov, you can put your zip code in and it'll tell you who's selling it. Here in Florida, we use a website called Florida Office of Insurance Regulation, FLOIR.com, to see the rates for the different supplement plans. And during your initial enrollment period, when you first join Medicare, that's when these insurance companies have to sell you a supplement without doing any underwriting. So if you have a pre-existing condition, the only time the Medigap supplement insurance have to insure you is when you are in your initial enrollment period. And so that might be really important for somebody that wants the supplemental insurance and has pre-existing conditions, because later on in life, let's say you don't sign up for the supplement, but you decide you want it 5 years from now and you have a pre-existing condition, the insurance companies are not required to insure you. Another thing about the supplements is that there are many insurance companies selling the same letter supplement. So we have, for example, 40 insurance companies in Miami, Florida selling one of these letters. And they all sell them for different prices, but they're all required by law to sell the exact same benefit. They're all selling these benefits you see on this chart. So therefore, it makes sense to go with the insurance company that sells the supplement for the lowest price because you're getting the exact same product as you would if you paid a higher price. So we're going to continue. It just says all plans of the same type must offer the same coverage. To buy a supplement, you have to have Part A and B. So the time when you buy the supplement is pretty much your initial enrollment period. When you enroll in Part A and B with Social Security, you're also going to then contact the insurance company to purchase a supplement. And every year during this open enrollment period between October 15th and December 7th, you could change. So if you had signed up originally for a Medicare Advantage plan and now you want to switch over to a supplement, you could do that. And of course, if you have a pre-existing condition, they might not want to sell you the policy, but you may find one insurance company that would and another one that would not. So we can give the list of all the insurance companies that would sell that, and then it's important to call them and see if they would insure. And so that's what I want to say about supplements at this time. Okay, so a lot of people say, listen, I can't afford to buy a supplement. And by the way, the supplements are based on your age and your zip code and whether you're a smoker or a non-smoker. So the older you are, the more expensive a supplement would be. And a lot of people come to me and maybe they're 80 and they say, I can't afford to pay for my supplement anymore, or I don't. Or they come to me and they're 65 and they're like, I don't want to spend money for a supplement. Okay, well then let's look at the Medicare Advantage plans. This is the other way to get your coverage. And they're also provided by private insurance companies. And they're also known as Part C plans. So it's important for you to note that if you join a Medicare Advantage plan, you're still in the Medicare program. You still receive all of your regular Part A and Part B covered services, and you still have all Medicare rights and protections. So Medicare Advantage plans are bundled policies. Members usually get all of their Medicare-provided health coverage from that single plan. So you have to go to the hospital, the doctors, and use the prescription drug coverage from that plan. And people may have to use specific doctors that accept the plan or go to certain network hospitals to get covered services. Because all Advantage plan members are still receiving Medicare coverage, they still have to pay for your Medicare Part B premium, which is $135.50 a month this year for most people. Depending on the specific Advantage plan that you join, you may have to pay other costs, such as additional premiums, co-payments, or co-insurance for their covered services. The benefit of joining a Medicare Advantage plan, one of them is that they may offer extra benefits such as coverage for vision, hearing aids, dental cleaning, health and wellness program. There are over 40 Medicare Advantage plans here in Miami, and they all want your business, so they're very competitive. In the category of Medicare Advantage plans, there are different types of plans. There's the HMO, which is the Health Maintenance Organizations, and members must generally get their health care from providers in the plan's network. So members have a primary care physician who must pre-approve all referrals to a specialist. Some HMO plans offer a point-of-service option where members can go to doctors and hospitals that aren't a part of the plan, but it may cost more. There are preferred provider organizations, which are PPOs, and they're very similar to an HMO plan. They have a network, except that the member can see any doctor or provider who accepts Medicare, and they don't need a referral to see a specialist. Going to a provider that's outside of the plan's network will generally cost more. So if we're thinking of a PPO, we want to compare and contrast that with the Medigap supplement to see what the benefits and the costs are. There is private fee-for-service plans. Members can go to any provider that accepts the plan's terms, and they may get extra benefits. So these private insurance companies decide how much it will pay the providers and how much members pay for services. We have special needs plans. These are plans that limit their membership to people with certain that are either in a long-term care facility like a nursing home, or there are other special needs plans for people who are eligible for both Medicare and Medicaid. Medicaid is assistance for individuals with low income and assets. There are also special needs plans for certain chronic and disabling conditions. And so special needs plans are available in limited areas. I have seen them for people with HIV, for people with heart disease. I have not seen one for people with cancer, but that could be something in the future. The final type of Medicare Advantage plan is a medical savings account plan, and these plans have two parts. One is the Medicare Advantage plan with a high deductible. One is a medical savings account into which Medicare deposits money that people can use to pay for their health care costs. And if used for Medicare expenses, the money is tax-free, and this is not available in Florida, but it is available in other states. So let's talk about the last part of Medicare, Part D. And Part D is your prescription drug coverage. So people that have A and B and they buy the Medigap policy, since Medigap supplement policies don't include prescription drug coverage, they also need to purchase a Medicare Part D plan. This is available to all people with Medicare. You have to be enrolled in a Medicare Part D plan in order to get coverage. And this coverage is provided by insurance companies. So these insurance companies are approved by Medicare to offer the Part D prescription drug plan. There are two types of Part D plans. One is what we call standalone prescription drug plans. They add coverage to your original Medicare, and then there are the Medicare Advantage plans like the HMOs and PPOs that include prescription drug coverage. So the term Medicare drug plan is used throughout this presentation to mean both the Medicare prescription drug plan and Medicare Advantage plans with prescription drug coverage. And so one of the things we can do on Medicare.gov, and you can do it, we can walk you through it, is finding out which Medicare Part D plan is the least expensive for the medicines that you take. And this could change each year. So it's a good idea to do this analysis every year between October 15th and December 7th. So let's talk about the cost of belonging to a prescription drug plan. So most plans have a monthly premium, which varies by plan. Some plans, premium is zero. Others have a higher premium. Most plans' premiums for Part D are between $30 and $60 a month. Some plans have an annual deductible, which is the amount that you must pay for prescriptions each year before the plan starts to pay. And these deductible amounts can change each year. So it's $415 in 2019. Not all plans have this deductible, but some do. And no plan can have a deductible that's higher than $415 this year. The deductible has to be lower than the standard amount. All plans are going to have a co-payment or co-insurance, and this is the amount that you have to pay if you're a member of the plan for each prescription after the deductible period. So for example, all plans must assign a tier for each drug on their formulary. The the Part D plan negotiates with the pharmaceutical company and they set the prices for the drugs. There are discounts on drugs during the gap in coverage, which is also called the donut hole. And while in this gap in coverage, your Part D plan doesn't pay anything. You have to pay for the drugs. And once a beneficiary reaches the dollar amount shown in out-of-pocket drug costs, then they have to pay 5% or a small copayment for the remainder of the calendar year. And so not everybody reaches this catastrophic coverage time, but some people do. And this is going to be an example of that. So we're going to start on the left-hand side, and this is the period of time called the deductible period, where the beneficiary, who is in blue, pays 100% up to $415, and the plan pays $0. And then if your medicine's expensive, you may reach the initial coverage level, or some plans that don't have a deductible start with the initial coverage level on January 1st. That's where the beneficiary pays a coinsurance. 25% is standard. That's a coinsurance. That's the cost of the drug, and the plan pays the balance. And this next period of time is the coverage gap, which is the donut hole, and the beneficiary pays 100% of the costs when in the gap. So the plan doesn't pay anything. And this year, you would pay 37% of the total cost of a generic drug, or 25% of the total cost of the brand name drug. And so sometimes people with very expensive medicine, they get in and out of the donut hole pretty early on in the year, and then their catastrophic coverage begins. And that's when you, as a beneficiary, pay a small copayment for generics, and for example, $3.40, and then $8.50 for a brand name, or 5%. I want to make a point that I know a lot of the cancer meds are pretty expensive. We also go to a website, which is needymeds.com. I think it's .com or .org, NEEDYMEDS, to see if there are patient assistance programs for very expensive drugs. So to select your Medicare coverage, initially or every year between October 15th and December 7th, we're going to look at Medicare.gov. This year, Medicare.gov is changing its website. The new website will be online effective October 1st. It's going to require people with Medicare to create an account, very similar to what you have to do on the Social Security website. And so once you've done that, all of the medicine that Medicare has paid something for will be loaded into your account. So it'll be very easy to do a plan comparison to see which is the least expensive Part D plan for you, or what would your copayment be for medicine if you join a Medicare Advantage plan. It'll be pretty accurate and reliable. So we can walk you through, somebody from Shine or SHIP can walk you through finding health and drug plans. And the phone number in Florida is 1-800-96-ELDER. I want to touch briefly on some financial assistance programs for people with Medicare. There's the Medicare Savings Program, which is a Medicaid program, and it'll pay for your Medicare Part A and B premiums, deductibles, and coinsurance if your income and assets are limited. The amount of income and assets you can have varies on a state-by-state basis, but definitely it's a help to many people who cannot afford to pay for that Medicare Part B. And so the SHINE program can help you do those applications. In Florida, they're processed by the Department of Children and Family. There's also extra help with prescription drug costs. It's called Low Income Subsidy. This is a national program, so it's also for people whose income and assets are limited. and it'll reduce or eliminate your co-payments for your prescription medicine, and it will reduce or eliminate the Part D plan premiums and deductibles. So this is an excellent program. And lastly, there's a piece on this about fraud and abuse. So we want to make sure that we report fraud. You'll get a Medicare summary notice showing what Medicare has paid on your behalf. You always want to check that and make sure that that is accurate. If it's not, you can circle whatever is incorrect and send it back to Medicare. So at this point, before we take questions, I wanted to bring up on the screen a kind of a little graphic of the two paths. So bear with me while I go ahead and get this up if I can. I'm going to try my best.
While Kathy is working on that, if you have any questions for Kathy, please feel free to type it in the Q&A box. I see people raise their hands, but you really do need to just type the question in order for me to ask Kathy.
All right. So I am not able to get that up, I don't think. But what I wanted to kind of just reiterate was there are two ways. One is you have your Medicare Part A and Part B. You buy the Medigap supplement and you buy your Part D plan. The other path is to join a Medicare Advantage plan. It's all encompassing. You're going to get your Part A and B and D from that Medicare Advantage plan, and you have to follow their rules and go to the doctors in their network or pay a copayment to go out of network. But here in our county particularly, we have a hard time finding doctors who will be willing to bill the PPOs. So that's a problem. The physician or the provider has to be willing to work if you go out of network. So that's something to be aware of. Okay, so I think I've stopped at 12:45 in my time. I want to make sure that
yeah, that's perfect.
Yeah.
So the first question is, for married couples, does each person register for Medicare when they are eligible?
The answer is yes. Each person has to register for Medicare. Nobody will tell you that it's time to register. So the time to do that is either when you've been disabled 24 months, you'll go to Social Security and let them know, or if you are turning 65 3 months before your 65th birthday month.
Okay, the next question is, what is the difference in cost between F and G, as I'm still working but wanted to be on F?
Okay. So if you're still working and you have insurance from your employer, you would not need to enroll in Medicare Part B nor buy a supplement. But to answer your question, once you do not have insurance through your employer and you want to go on Medicare Parts A and B and buy a supplement, of course the price is based on your zip code, your age, and whether you're a smoker. So I'm going to give you the example in Florida, which it could be completely different for California, or wherever you're located. But in Florida, the least expensive F, like Frank policy right now for a 65-year-old male non-smoker is around $285 a month. And the G right now is a little bit less expensive. They're trying to encourage people to go on the G. Of course, if you're going for the A policy, which has the least amount of Medigap benefits, then you're looking at probably around $40 a month. Also note that this year there is a high deductible F, which has a very low monthly premium, but then you pay a couple thousand out of pocket. So that would be great if you are just trying to insure yourself for a catastrophe, basically.
If I live in both New Jersey and Florida, do I have to be a resident of New Jersey for a particular length of time to qualify for a New Jersey Medicare or Medigap?
So Medicare is a national program, and you can live anywhere for any amount of time, as long as your address with Social Security is wherever that is. That's where your Medicare is going to be registered. So there's no time requirement as far as purchasing Medigap insurance either. Regarding the Medicaid, the assistance for a low-income individual, you have to have your legal resident registered in that state in order to get those state Medicaid benefits. And I don't know if there's no time requirement. The only time requirement I've seen is for two reasons. One is if you come to the United States as an immigrant, you have to be here for 5 continuous years before you're allowed to purchase Medicare. And then the second reason is if you've been disabled, you have to have been disabled 24 months by Social Security, which is national, in order to then receive Medicare. I hope that answers the question.
Okay. If anybody has any other questions, feel free to type it in. So far, okay. The next question is, what is the penalty if my employer's plan is not creditable?
Okay. So let's say somebody thought it was and it wasn't. Social Security is going to determine what the penalty would be. The penalty for not enrolling in Medicare Part B, like boy, is an annual penalty, and I don't want to tell you the wrong percentage, so I can't state what that is right now. But if you call Social Security, they'll let you know. It's based on the time that you should have had Medicare and you didn't. Then the penalty for Medicare Part D, like drugs, is 1% of the average annual premium for the years per month for the years that you should have had Part D for the drugs. So Social Security will also tell you what that is. If your income and assets are limited, it would, and we apply for the Medicare Savings Program, it would pay for the penalty also. So that's something for people to know. Although if you've been working, it's probably you have too much, but it's worth looking at that. If somebody's eligible for the low-income subsidy, extra help for Medicare Part D, that will also pay for the penalty for late enrollment in Part D.
The follow-up to that was if you disagree with that credible determination, is that appealable?
Yes. Everybody has the right to appeal, and when you're talking about the penalties, the appeal would be done with Social Security Administration because they handle the enrollment. And if you go to ssa.gov, the Social Security website, they have the form to do the appeals.
Great, thank you. I don't know if you know the answer to this. Kathy was at Life Fest last year, but one of the participants today asked, what do most LifeRaft group members on GLEVAC use, F or G?
I don't know the answer to that. Obviously, in the past, people that could afford it signed up for F, like Frank, because they wanted full coverage, and it's just easy when you don't have to worry about bills. But
don't quote me on this, but I'm pretty sure that it was F. So when I heard you today say that they're eliminating F, I have to be honest, it did concern me for our community.
So they're eliminating F, and then everybody will have to go on G, which if you're going to buy a supplement, which means that you're going to wind up paying the $185 annual deductible for Part B out of your pocket every January, and then everything else is covered.
Okay. And then another question was, has it been determined if the drug gap will be 0 in 2020?
If the drug app will be 0?
The drug gap. The drug gap.
Oh,
I also
gap.
heard about that.
Yes. The law, when they passed the Affordable Care Act, it said that the donut hole or that gap in coverage for Medicare Part D was going away slowly over time. And I haven't seen the prices yet, but according to the law, it is supposed to be zero. What I have seen happen, like you'll notice this year, the amount that people pay for brand name and generic is less than in prior years. But the Part D plans, insurance plans are kind of smart, because what I've seen happening is the co-payments for the medicine are creeping up. So you've got your no donut hole, but then the price, they don't lose money. I mean, I'm sorry to say. So that's why it's important to do the comparison every year to see which is the least expensive.